This video will demonstrate the transfer of a neuro patient from lying to sitting, towards their affected side. The therapist once again starts by introducing herself to the patient and explaining the transfer. The therapist then rolls the patient towards their affected side using the correct technique, as demonstrated in previous videos. The therapist encourages the patient to use their unaffected foot, placed behind their affected ankle, to bring their lower limbs off the bed, with the therapist assisting by placing her hand behind the knees, while their other hand remains on the patient's shoulder to ensure stability. The therapist then encourages the patient to place their unaffected hand on the bed, using it to push themselves into a seated position, while the therapist's hands are placed on the patient's hip and under the opposite shoulder to assist, while avoiding pulling on the patient's neck. The patient's hands are placed next to her to ensure stability, and the bed lowered to the appropriate height. The therapist assists the patient to bum shuffle forward with one hand remaining on the patient's shoulder at all times to ensure balance, and the patient's feet are placed firmly on the floor.